As we can see here, William Cranage has just gone into cardiac arrest.
What happened? Sir, can you hear me?
Every year, 610,000 people in the United States die of heart disease. That's 1 in 4 deaths.
Can you hear me? No phone. Cardiac arrest. Starting CPR. Alright, you got it.
The manual monitor defibrillator has revolutionized pre-hospital treatment of heart-related illnesses. It allows healthcare providers to treat heart dysrhythmias, heart attacks, and cardiac arrest more efficiently.
Alright, so this is the LifePak 15. It's kind of the industry standard now as far as portable monitors go. As you can see, it's a lot better of a display than the 11 or the 10. Pretty much everything you need to know about the patient is on here. We have blood pressure, end tidal CO2, which tells us how much carbon dioxide the patient is breathing out, and therefore how much is in their bloodstream. That's an important vital sign with a lot of respiratory patients, COPD, asthma patients. We have oxygen saturation. As you can see, Luke here is a healthy young man, 100% oxygen on room air after smoking, so pretty good. Heart rate, this is definitely room air, isn't it? Oh, my bad. Heart rate at 80. Also displays the rhythm here, which of course a healthcare provider can interpret. Then you have your waveform here, which tells you each time the patient is exhaling. So, rundown of the LifePak 15. We can't take 12 lead EKGs. As you can see, we have the electrodes already hooked up to Luke's chest. Able to snap a better shot of his heart. We've already inputted his age and gender into here. I'll just snap out a picture like so, which we can interpret as whether he's having a acute MI. In this case, it's obviously not the Luke. And then also, if we were taking Luke to a local hospital, we could transmit via cell phone reception. So that's about all there is to show. So we kind of went through the rundown of things we can more regularly do with the patient. As far as more acute patients in dysrhythmias, we can, of course, defibrillate a patient, which would be in a cardiac arrest situation. Also, using the pads, we can pace a patient, which you can see we have the pacing right here. You just go into pacing mode, and you can set the rate and the voltage. That would be for a patient who's in a very slow heart rate, so we could bring them up to an appropriate rate by rhythmically zapping the heart, which would cause also mechanical capture of the heart, which causes it to pump. Also, if someone was in a very rapid rhythm, like SBT, we could synchronize cardiovert them, which is where it's kind of like defibrillation in that you shock the heart, but because they're in an organized rhythm, you want to shock them at a certain point in the rhythm so that you don't throw them into cardiac arrest. So you just hit the sync button here with the pads applied to the patient's chest, and it would hit at a certain point actually on the QRS complex, and it would shock in tandem with the heart's normal electrical activity and hopefully bring them out of that rapid tachycardia. So for more acute patients, those are two things that the LifePak 15 can also do.
How does a heart monitor defibrillator work?
So there are two kinds of monitor defibrillators. There's an automated external defibrillator, which is used by lay people and less trained healthcare providers. And there's a manual heart monitor defibrillator, which is kind of what I based this image on here. The difference between the two is an AED, an automated system. takes the electrical impulses from the heart and interprets it for you and tells you whether or not the patient needs to be shocked, which is defibrillation, shocking the heart. And the manual system just interprets, translates the electrical impulses into an image which a healthcare provider has to interpret.
Who uses each kind of heart monitor and defibrillator?
Well, as I said before, the automated external defibrillator, the AED, is more reserved for lay people and less trained healthcare providers, because to use a manual system you need to have knowledge of interpretation of heart rhythms. So something like this would be used by paramedics, doctors, nurses, anyone with formal training.
What are some pros and cons of the manual defibrillator?
Well, probably the biggest pro of it is that we can interpret heart dysrhythmias in the field using this device. So short of something maximally invasive like a surgery, we can treat any dysrhythmia in accordance with the American Heart Association's guidelines. So like not every cardiac patient is in cardiac arrest. Like a lot of people are in like SVT, which is an extremely rapid rhythm that we have to slow down, or like bradycardia, which we have to treat in the field. So it really has expanded the amount of cardiac care that a patient can receive before ever seeing an ER. Another benefit of the manual system, the manual monitor defibrillator, is that we can now do 12-lead EKGs in the field. So if someone's having a heart attack, which is not all heart attack patients go into cardiac arrest. A heart attack is caused by a clot in one of the coronary arteries, which supplies the heart with blood. We can do a 12-lead EKG in the field, which is, in addition to these 4 leads, they're called unipolar leads, or also augmented leads, because they're augmented by the computer system onto the chest. It goes down the left side of the chest and takes a snapshot of the chest, and that allows us to definitively tell if a patient's having an acute MI, a myocardial infarction, which is a heart attack. And we can transmit that to the hospital, and so that they're ready to treat that patient as soon as we walk in the door. So it ultimately saves heart tissue, it saves people's lives.
Okay.
As far as cons go, the portable manual monitors, they're extremely heavy and expensive. The LifePak 15s that we use at work, which are kind of like the industry standard, weigh almost 20 pounds and cost tens of thousands of dollars. And a lot of their equipment that you use with the monitor, like blood pressure cuffs, leads, that's all even more money. So it's expensive for companies to use them and to maintain them.
What would health professionals do before we had the manual defibrillator?
Well, I'd say that this has really kind of revolutionized pre-hospital treatment of patients, because before we had this, there wasn't as much formal training for EMS. So when you called 911 at one point in time, you literally just had 2 people who were trained in CPR. So if you were dead, they could press on your chest and they take you to the hospital in a hearse. So something like this has really put medicine out on the streets and enables us to treat patients out of the hospital. So these are 2 of the older portable monitor defibrillators. On the truck that's out right now, we have the LifePak 15, which is kind of the current industry standard. Here we have the LifePak 11, which is the model that came prior to the LifePak 12, which is the model right before the 15. This was kind of innovative at the time because it was the first field monitor that could perform a 12-lead EKG, which would be, in addition to the 4 leads that tell you what heart rhythm the patient is in, you could plug this in to the port here and hook that up to the patient's chest and take a picture of the heart to determine whether they're having a heart attack in the field or not, and transmit that to the hospital. So this is really what revolutionized cardiac care in the pre-hospital setting. The LifePak 10, which is the model right before the 11, came out in 1989. It was the first model that could pace patients.
Without this technology, William could have lost his life today. In the future, heart monitor defibrillators will likely follow the same trend as other technologies. Cable connecting leads to patients' chests will likely go cordless, possibly in favor of Bluetooth. Lighter, less expensive monitors will take over the industry, as companies look for equipment that will enable them to more quickly and efficiently treat patients.